Shifting over to what we're seeing here as hospitals are also grappling with all this as we do await a vaccine. We have seen case counts overall trend a little bit more in the right direction, a lot of the direction that we've been hoping for after those serious rises in cases that we saw play out in California, Texas, Florida, and Arizona. And for more on that, I want to bring on our next guest, Dr. Jabraan Pasha, an internal medicine physician at the University of Oklahoma Medical Center in Tulsa. Dr. Pasha, good to chat with you again. Last time we were talking right before President Trump's rally in your state. Just want to quickly get your reactions to the conversation we just had there, particularly around the Pfizer and BioNTech news there, that they're getting $2 billion to work on delivering 100 million doses of their potential vaccine candidate here. What's your take on the advancements that we're seeing on that front?
Yeah, thanks for having me again, Zack. Since all of this kind of started, we've in the healthcare side and lay people alike have really been in search of that silver bullet in the form of some sort of therapy. And as time kind of continues to move forward, it's becoming more and more unlikely that we're going to get that silver bullet that's really going to treat COVID-19 effectively. And so, I really think the closest thing we're going to get to this silver bullet is going to be in the realm of vaccines. And so, the economic side is a little bit out of my scope. But if we can deliver a safe and effective vaccine, I think that's really what we need to lean on.
Yeah, and obviously there's going to be a few months there before we get that, even on the most optimistic timeline. So in the meantime, we're watching hospitals and doctors like you struggle to actually treat patients who do contract COVID-19 here. And in your state, things have not looked great after your guys' health commissioner there planned an emergency plan here. It hasn't been enacted yet, but it would add about 340 additional beds across 7 hospitals in Oklahoma City and 1 in your city, Tulsa. The plan, again, not activated yet, and hopefully it won't need to be activated. But as we see hospital beds become scarcer and scarcer, what's your take on how the hospital system there in Oklahoma is actually able to potentially beat back some of these cases?
Yeah, and then, in the grand scheme of things, the addition of 300 or so plus beds may not be anywhere near enough. We have about 7,000 total beds in Oklahoma, and so adding an additional 5% may be more, just a bit more than a drop in the bucket. We're running at about 80% capacity across the state in terms of our hospitalizations, and really the thing to keep in mind is that when you're dealing with COVID-19 inpatient, patients come in faster than they go out. Meaning that the average length of stay for a COVID inpatient is about 7 days, right? And so if you have a few days of a significant influx, those hospital capacities can be stressed relatively quickly.
And when we talk about what all the efforts here has been geared towards and really flattening the curve to avoid that doomsday scenario, Oklahoma has become an interesting example, shall we say, to point to, since it's one of the few states that we haven't seen enact a statewide mandate for masks. Your governor, Kevin Stitt, became the first U.S. governor to test positive for COVID-19 and has pushed back against a statewide mandate as well. What's your take on how the state has grappled with that and not using masks and what we've seen play out so far in Oklahoma and how it could have been improved if that weren't the case?
Yeah, honestly disappointing from the perspective of a healthcare provider who kind of walks into these hospitals almost every day and sees the aftermath of what COVID can do. But ultimately, it's been left up to the local municipalities and, Oklahoma County, which is the county where Oklahoma City is in, Tulsa County here in Tulsa. Our city councils have stepped up and passed ordinances to mandate masks. And if you get the 2 biggest counties in the state to have universal masking, you'd hope that would play a big part of flattening this curve.
Yeah, and I guess lastly, to wrap up here, kind of stepping back beyond the states and looking at the U.S. as a whole, obviously, we have not done a great job in managing cases compared to even Italy, which was the poster child of how bad things were before it came here. And yesterday, Yahoo Finance talked with Surgeon General Jerome Adams, who did defend local mandates like the ones you're talking about here, instead of having it be at a state level or even a national level. But when we think about New York now having to order travelers from 31 states to self-quarantine without really any true way to enforce it or police that, do you really think that it is the best approach here to leave it up to the states?
I don't know that that's for me to say. Obviously, I wish we could get a more unified response and get everyone on the same page. We've left a lot of things up to the local cities or even the individual in terms of just recommending that masks be worn, and we've seen that hasn't panned out very well for us, and so we've got to play with the hand that we've been dealt, and so right now. Some of the cities across the country, some of the states across the country have been willing to mandate masking, and so that's kind of where we're at.
All right, the update there from Oklahoma from Dr. Jabraan Pasha. Appreciate you taking the time to bring us that, and good luck out there.
Thanks for having me.